What is up, everybody? It's Dr. Rafich here. Waiting for followers to be aware that we are going live any minute now. Hello, hello. Myra.oreo. Those Oreos. They'll get you. What up, Sammy Habada? Welcome, people. Welcome, folks. How y'all doing? Thanks for joining. Should be informative. Should be a lot of fun. It's Dr. Rafich here, representing the basic. From Vet Triage. TryTheBasic.com. Check him out for all your pet supplements. Get some more time for people to join. Kasha Doodle, what up? Maria Neves, 54, hello, hello. Thanks for joining, everybody. Fantastic. Good to have everybody here. This is Dr. Shadi Arabich from Vet Triage, representing the basic. TryTheBasic.com. Get some supplements there. Hey, Charity! What is up, Charity? A true hustler, that's for sure. So we figured we'd open up the platform here, everybody, to any and all pet-related questions. Well, I guess animal-related. They don't have to be your pet, I guess. I'll try my best to answer them. Charity, you come to Vegas, you let me know. You let me know. We'll hang out. We'll do the thing. And so talking to the basic, we do collab, and I figure we can talk about anything related to animals. I figured I'll just go into kind of a discussion on gastrointestinal health for dogs and cats, and we'll kind of see where the conversation takes us from there. So they do offer, actually, at the basic, a gastro balance booster for dogs. Hi, Crystal V. Lee. Ask any questions, guys. I'm just going to keep talking about gastrointestinal health in dogs and cats, and you are welcome to just interrupt with questions. What's up, Negs? BZS Wish. So gastrointestinal health. So one of the most common concerns we get on Vet Triage, which is a 24/7 United States-based veterinary telemedicine service that offers teleadvice and telehealth 24/7, is gastrointestinal problems, gastrointestinal GI upsets. You see it a lot. Yes, Negs, ask a question, go for it. I'll stop what I'm doing and answer any questions everybody has. What's up, Phoebe, Lil Fox, Bella, und Bunny, what up? So we see this problem a lot, and actually the reason why I do like their Gastro Balance Booster in TryTheBasic.com is because it does actually have Lactobacillus acidophilus, which is a organism that is supposed to help with rebalancing the gut. And so anytime a person or a dog or a cat has a problem with gastrointestinal issues, most commonly, or I'll say one of the more common reasons, is because of what's called dysbiosis, which is where you have an imbalance in the good and bad bacteria in the stomach and intestines. Well, I guess we'll focus on the intestines. Stomach technically is sterile because of its low pH. So the lactobacillus tries to help repopulate the good flora, bacteria population in the intestinal tract. Negs, my dog that weighs 12.5 pounds is on Vetmedin and just got prescribed an Alpril. Can he take them together? Should I space them out? You can take them together, that's fine. Just make sure you're relatively consistent with the timing of the medications, but you can give them together. They don't interact with each other, and they're both are supposed to help the heart in different ways. I hope that helps you, and I hope your pet feels better. Feels better soon. Hi, I'm Mime78. You never know with these names if you just say them out or not, or just spell them out. But welcome, regardless. So we see gastrointestinal upset, dietary indiscretion in dogs very commonly, especially on vet triage, but any veterinarian will tell you they get vomiting, diarrhea, lethargy, anorexia, all those problems, bloated stomach, gassy stomach. They can hear them gurgling in there, and so you think, well, what do I do to help those pets out? What's causing them? I'm Mime78 with a question. Hi, my cat is 3 years old, and I can hear phlegm. Is there anything I can do over the counter? It depends on the cause of the phlegm, so you need testing to figure that out. Pretty safe medications over the counter that are also in any human pharmacy are things like Pepsid, regular Pepsid, which comes usually in 10 milligram tablets. I think it comes in 20 milligrams as well, so you can try that also. Omeprazole is another antacid, a different class. It's also Prilosec, and that also can help pets as well, but always do these things under the direction of your veterinarian. And in this type of forum, I would need to ask you more questions, but basically if the phlegm is gastrointestinal in nature, you could consider those therapies as long as the veterinarian looks at your case specifically. If it's phlegm from an airway thing, like we're coughing up phlegm, that's a much more complicated scenario. There's not much over the counter. You could consider hanging out in the bathroom with your cat, close the door, turn on the hot shower, let it steam up. And that kind of sauna environment will help humidify the airway, help moisten things up. And maybe that'll help break up the phlegm that's being produced. And you can do that 3 or 4 times a day, 15 minutes at a time, just hang out in the bathroom with your cat. Don't go in the hot shower with your cat. You're just letting the room steam up. And you can do that for 10 or 15 minutes, 3 or 4 times a day. That'll help with the phlegm, break up all the fluid there. I hope that helps. Thorgon9, what is up? Daryl the Dodge, welcome. Welcome, guys. So we were talking about the basic and their gastro balance booster for dogs. I was saying I do like them because it has lactobacillus acidophilus in there, and so that helps rebalance it. Another potential therapy, if you're in a crunch and you're waiting to order the supplement from the basic, but you want to do something right now, you can do some plain yogurt as well. Yogurt with live culture can also help with kind of rebalance the gut. Thanks, Amy. Thanks for clarification of your name. Charity, what's up? I plan on getting a golden doodle since I have allergies and I heard they are hypoallergenic. Any knowledge around this pet? Yes, I got some knowledge for you. Lindsay, huge supporter of my channel and vet triage. Thank you, Lindsay. Shout out. Charity, fantastic. So there are dogs that are considered hypoallergenic in that they don't really shed, or they shed minimally. And the golden doodle is a good example of that. Poodles, either the standard or miniature or toy, are also good examples. I just learned about a breed called the Bernedoodle, Bernese Mountain Dog with a poodle. They also have hypoallergenic fur, so I think it does work really well for people. You can also always go, if you want, to the hairless route. You get all those hairless dogs and cats, and you can have all the fun of having a pet while petting what feels like a defeathered chicken. I don't know. It's you have to like that kind of a texture. But you can do a dog or cat with no hair if you want. Otherwise, hypoallergenic dogs that have kind of curly hair, the shorter hair, they tend not to shed as much or not shed at all, and that'll help you with allergies if you want to have a pet. So hopefully that helps you a lot. Let's see, Amy, thank you. I did take him to a steamy restroom and it did help. Boom! Shout out to steamy restrooms. Charity, no hairless pets. I get it. Yeah, it's a little rough. Amy, do cats need to be bathed besides having them bathe themselves? So if you have a cat that's sufficiently weird enough to like water, then you can bathe them. That's fine. But otherwise, they tend to groom themselves. If you have a cat that either has really bad arthritis and they're not really like flexible enough to groom themselves, or a cat that's really obese, really overweight, that also can't reach around, then yeah, bathing is going to have to be the way you go. Otherwise, you can also seek out a groomer that's comfortable with cats and have them groom your cat as well. So that's the way to go there. Thorgon 9, I'm just waiting for them to come up with the Thorgon doodle. If you can make that happen, I support you. I support you. That's funny. So hope that helps, Amy, with your question. Cats do hate that stuff, and so if your cat really does hate it, either they have to just groom themselves, or you can go to a vet and grab some sedation that's safe to use, and you can give your cat the sedation before they go to the groomer or before you're gonna bathe them yourself, and that'll help with taking down the anxiety. Next, if my dog is 11 years old, stage 3 heart murmur, and he's taking heart medication, is it okay if he goes under for surgery? He has bad tooth. So the problem with anesthesia in general, whether you're healthy or not, young or old, whatever it is there's always inherent risk, right? We perform the anesthesia with the understanding that the benefit of the procedure being performed, the benefits outweigh the risks. That's why you perform anesthetic procedures, because it's worth the risk. If the dental disease is sufficiently bad enough that your veterinarian is recommending that it have be removed, or along with a dental prophylaxis, and it's impacting quality of life, we're not really eating that well, we're losing weight, we're grumpy, we're chattering our teeth, we're salivating, we have bad breath, all these signs, then it's probably worth it. That being said, you can get further clarification for your pet's heart murmur by seeing a specialist, either an internal medicine specialist, a radiology specialist, or a cardiologist for animals. They'll do an echocardiogram, which is an ultrasound of the heart, and try to figure out what's causing the murmur and what the level of risk is. So that'll help give you more information. Beyond that, it's if you have your diagnostics from your family vet, the ultrasound from the specialist, and they think, okay, well, that being said, everything is okay. You should be okay for anesthesia. There's always that inherent risk. So you have to do it with the understanding that the risk of anesthesia do not outweigh the benefits of it, and of course try to speed up the procedure as much as possible, all the while being safe and efficient, because you don't want to rush a procedure needlessly and haphazardly, but you also want to get the job done too. So, Thorgon 9, why do cats when they are dying go to a secret place or away from their owners? Yeah, I'll tell you, it's interesting. You have those like pets that can predict the when their pet owner is going to have a seizure or narcoleptic attack or whatever, when they can tell ahead of time. You're welcome, Negs. There's something about dogs and cats, they sense a certain level of energy that I don't think we understand. And it's the same way they can tell if you're really sick. They can preemptively tell you in some cases, and I'm sure there are plenty of people online that have claimed this, that they can tell that the owner is sick, even though the owner doesn't feel sick. And you go to the doctor, get checked out, and they find something. So I think that cats, when they know that the end is near, they just know. They have sort of this, and dogs, they have this sort of inherent knowledge. But besides that, why do they hide? I think that is part of a survival tactic. I think that if you have a pet, or you have a wild animal, for example, who's sick, they know they're ill, they know that their time is coming, they're trying to just get away from everything. And if you look at it from a herd health standpoint, if you're part of a group, let's say you're a herd of you're a pack of wolves, and you're dying, the last thing you want to do is bring danger to your pack, and by slowing them down, by fumbling around and not being covert outside in the wild. So you don't want to attract predators. So I think probably they're doing it as their own kind of, okay, I'm done, just let me be and let me finish out the rest of my time. But they're also trying to protect their pack, and so you can consider you as the human being part of their pack. And they're trying to say, okay, I'm not gonna bring you trouble. I'm just gonna go ahead and deal with this myself and move on. And keep in mind, they're animals. They're as much as we personify them, they are going to do things that are inherent to their biology. So it's just that's my theory on it. I don't know what the answer is, but that's what I think. So I hope that helps you out a lot. Amy, my cats seem to get very scared with any little noise. He's 3 years old. Had him since 8 weeks. Any recommendations? Well, first step is stop the noise. You can always try and figure out what in the environment is causing the stress and try and eliminate that stress. Secondly, there are medications you can use that you get from your vet, acepromazine, trazodone. There's also herbal sedatives. People are using now CBD, things like that to try and help take the edge off of anxiety with pets. And so we have those remedies for those. The best thing to do is just eliminate the source of the stress, obviously. So That's what I would say. Otherwise, those kind of medications, sedatives, tranquilizers, nutraceuticals can probably help. You can also try actually getting the product called Feel Away. You can Google it, FELIWAY, something like that. It's like one of those plugins in the wall, and it's supposed to give off some sort of pheromone for cats. Maybe it calms them down, so you can try that as well. Thorgon 9, oh, you're very welcome, my friend, very welcome. Thank you for all of your support. You are a rock star. Lindsay, my dog's paw pads are really dry. Anything I can do? Yup, you can. Next question. I'm kidding with you. Yeah, you can do a couple things. So, what's up, famous Amos 13? Shout out. So, Lindsay, what you can do to try and help moisturize your pet's paw pads, a couple things. Fish oil supplement. I like Welactin, WELACTIN. It's a fish oil supplement. I know what's in it, and that'll help with overall skin issues. And you can think of the pads as being part of the skin. Secondly, you can try and protect the pads from trauma in the environment by wearing booties. Let's say if you're going to walk on gravel or concrete or hot surfaces outside, you can do that. Third, you can try and do either some kind of a lotion, like suntan lotion, but you want to make sure they're not going to lick, so you want to absorb it, really rub it in. Or you can try vitamin E ointment that also can help as well to help with the health of the surfaces, like the nose, the paw pads, things like that. That'll also help too. You want to make sure they don't lick the stuff. Not that it's poisonous necessarily, but it's going to be gross tasting. They're going to drool, and then you're going to call vet triage for advice on drooling, of which we'll be happy to help you. Amy, I'll try some of your recommendations. He gets scared with even someone walking by. Yeah, that's life. We're all scared. But yeah, you can't do much about that. I mean, some pets are just wired that way. They're just nervous, and you can try the things I mentioned. You may want Feel Away, actually. That might be best in your scenario if you want to try that out. There's no side effects to it. It's either going to work or not, but you can try that also. So, Thorgon 9, you're laughing. You're welcome, Amy. I hope your cat gets more confidence, Amy. Yeah. You have to seek out some motivational speakers online. So back to gastrointestinal health. So dysbiosis, which is the imbalance of bacteria in the intestines. And so we see that a lot. And so the Lactobacillus acidophilus and the basic, trythebasic.com maybe help you with their gastric booster, the gastro balance booster for dogs. How to clean a cat's ears. Cats are tough in general to give medications to, as well as to clean their ears. Actually, what I do for my clients on vet triage, the pet parents that come to us 24/7, anywhere in the world, any species, is we send them a summary at the end in their email, usually, depending on the case, but usually. And so I actually attach a YouTube video on how to clean cat ears in there. So if you go on YouTube, type it in, how to clean cat ears. There's some really good videos that are made by veterinarians, veterinary technicians that can tell you how to clean a cat's ears. Hope that helps. So the other thing is there are some pets that if they have chronic gastrointestinal disease, meaning they fluctuate every couple of weeks, every couple of months, diarrhea, vomiting, nausea, bloated stomach, noisy abdomen, that they have something else going on. It's not just as simple as just they ate something weird and I just didn't catch them, or they got I changed the diet and that must be the reason why it's always happening. And if it's chronic, you want to seek out actual testing. At some point, telemedicine and nutraceuticals and supplements can only go so far. If they're not working for you and it's a repeatable offense, then you probably should go get checked out. And you can consider a specialist, like an internal medicine specialist, so they can do the fancy testing. Blood tests, x-rays, abdominal ultrasound, even upper and lower gastrointestinal endoscopy can do it. So keep that in mind too. A lot of us ignore the chronic recurring gastroenteritis cases that we see with pets. And so we want to just make sure that we're actually addressing these problems. And so, go from there. Famous Amos, does it matter if my kitten eats wet cat food and not kitten wet food? Gotcha. Give me 1 second, guys. So, does it matter? So, If you're asking about the wet part, there are some people that believe that dry food might be better because it'll help break up tartar in the teeth, and so it's more of a grinding friction thing. So there's the benefit there. The downfall to it is it doesn't have moisture. The good thing about wet food, even though maybe it's worse for the teeth, it does help with hydration, and therefore you may prevent diseases that we see in cats, like urinary or kidney disease, that are very common. If you're asking about, so that kind of depends on where your focus is. And of course you can do a mixture. You can also add water to the dry food. You can do various things like that. If you're asking about kitten food, or rather cat food for a kitten, then that's fine as long as they have their teeth and they're able to chew. You need to make sure the food is soft enough for them to eat, like they're off being bottle fed or being weaned off of the mom. Thorgon 9, we use Royal Canin urinary SO moderate calorie pet food for our male cats, or anything cheaper out there, $20 a box. If you're looking at prescription diets, which is what that is, unfortunately not. If they're prescription, then they really are tailored towards a medical condition, and you want to make sure you follow that advice. They do have over-the-counter kind of urinary diets, but they're not prescription, and you don't really, they're claiming stuff, sure, but you don't really. Sorry guys, 1 second. You don't really know. The prescription diets are great because they come from reputable companies, and also there's research to back them up. So that's why. So it's probably worth the money, especially with urinary issues, especially in a male cat, because they can get life-threatening urinary obstruction, which is very common. Sorry. I hope that helps, Thorgon. Famous Amos, hard to find kitten food. That I can't speak to. That I can't speak to. I guess anything outside of like KMR, which is a kitten meal replacer, maybe it is. I'm not sure. Hi mollymeg.cats. Amy, what are some best store brands? So, Iams, Eukanuba, Science Diet, Royal Canin, Hills. These are the best in the field so far. And then there's more now coming out. There's a lot of companies now, like Just Food for Dogs, the Farmer's Dog. These are other diets that are out there that are also helping. Crystal V. Lee. My girlfriend's pup doesn't have much of an appetite. Is there a way to boost appetite? You can try thebasic.com. They have a gastro boost for dogs. You can try that. That'll help. The other way is basically, if you want to be like ruthless about it, you can say, well, eventually my dog will be hungry, and so just give them the same food over and over again until they finally eat it. There's that. There's kind of like tough love like that. Otherwise, it's a matter of trial and error to figure out what kind of diet. There are some dogs and cats that are just bad eaters. And they're just bad eaters, and it's some people like that too. They're just not big into eating. They just eat enough to survive, and that's the end of it. So it's hard to say for sure. Obviously, of course, if the appetite is not great and it's a new thing, then you probably should get checked out at the vet with some blood work, x-rays, fecal exam, that kind of stuff. Thorgon 9, we have 2 feral kittens on our work site. We don't want them to perish in the winter. Is it okay to feed them wet/dry food? Is it okay to make a shelter for them? Sure, yes to both. Yes, Crystal V. Lee, Gastro Booster. Try thebasic.com. They have that there, and maybe it'll help with gastrointestinal health. So you can try that as well. It's a fairly safe option there. But Thorgon, that's fine. The alternative is that the kittens don't have any other options, so you might as well do the best you can to help them out. If you're not sure how old they are, if they have older teeth, or if they have baby teeth, or whatever it is, then you can try and soften up the hard food. Hard food will last longer outside as opposed to canned food. But Negs, do all dogs go to heaven? Well, I'm going to refer you to this movie called All Dogs Go to Heaven. They'll tell you. They've got the answer. You're welcome, Thorgon. So if you have an animal, dog or cat, that has chronic GI issues, then you want to seek a further testing to figure out what's causing it and you want to probably at some point find out from an internal medicine doctor what the deal is, a specialist, and that's going to help figure out your gastrointestinal disease. So that's the idea behind that. And these are for chronic issues. They're for things that you've been dealing with for weeks, months, years, on and off, periodically, and so that's why they have specialists like that to figure out these chronic issues. Because all too often we kind of forget that these pets need, they go through these gastrointestinal issues, and we just sort of just deal with it every year. It's so crazy. Yeah, if it was you as a person, you'd probably try to figure out what's going on. So I recommend pursuing these things, especially if it's becoming more of an ongoing problem. So I would do that. But otherwise, let's go over some signs that your pet has a gastrointestinal emergency, like it's a true problem. You either can go to vet triage, of course, and get a session there 24/7 all around the world, no matter where you're from, and we'll help you out to determine that. Otherwise, things like really bloated abdomen, like all of a sudden the belly's big, you got to go in. It feels like a drum, like you just like tympanic, you got to go in. If you have a pet that's vomiting fairly frequently after every meal, after drinking water, and it's just nonstop, you got to go to the vet. You know, these are signs that there's an issue. If you have a pet that's obviously dehydrated, so for example, their gums are dry, or you pull on their skin, their scruff, and the scruff kind of tense and doesn't really go down right away. Normally it's just kind of go down. If it's sort of tense there, that's a sign of dehydration. You got to go to the vet. So these are all signs that you probably can't wait, you should go. And those are really important things because in those situations, time is of the essence. If you have diarrhea, that's one thing. If you have really bloody diarrhea and it's copious, you gotta go to the vet. So these are all situations where a pet needs to have diagnostics done and treatment and hospital treatments. Amy, is it true alkaline water is better for cats? I have no idea. I don't know. I mean, this alkaline thing is news to me, just with people. So I don't know what to make of it for dogs and cats. I don't know. I don't know. I guess I would have to say defer to your vet, or if people are saying things online about it, then, maybe. You can always try and do a medical literature search. Go to pubmed.org, and that's where all the medical literature is for people and for animals. And so you can Google, you can search in PubMed, PUBMED.org, and maybe there's some studies out there on alkaline water for cats, but I have no idea. Lindsay, what percentage of a dog's calories can come from treats each day? So ideally, in order to prevent weight gain, overt weight gain, you would just feed your dog just the dog food, and that's it. If you want there to be treats, you can also find recipes online where you can take the dog food that you normally feed, and make treats out of them. That's another way, make like cookies out of them. That way they feel like they're getting a treat because it's like this bonus meal, but it's really just their dog food. And then you can lessen how much you feed them for the next meal. That's another option. As far as exactly what percentage, I mean, probably 0%. But that's because I see so many overweight and obese animals that it's like just feed them the regular food and that's the end of it. But there are also nutritionalists you can look into. I think Hill's dog food company used to have a nutritionalist. I think for pet owners you can call to get more information from an actual nutritionalist too, if that helps. Thorgon, my favorite animal, the cheetah. Cheetahs are my favorite animal, hands down. They are sleek, they're beautiful, they're fast, they're like made for efficiency. They're the only large cats to purr. They have permanently retracted claws, so it provides constant traction for them. They're unbelievable. So I think they can run up to 60 or 70 miles an hour, something like that. They're insane. So they're my favorite animal. And of course, they're endangered, so we need to, up them. The problem is they are very difficult to breed in captivity, last I heard. Crystal V. Lee, is it normal for pups to lose multiple teeth at a time? Yeah, they can. They'll lose the teeth. They'll either swallow them, in which case it doesn't cause a problem, they just poop it out, or you'll find it in your house. There is the occasional and rare scenario where a tooth gets inhaled and actually goes into the lungs. That's insanely rare, but it has happened. So, yeah. Freddie G, what's up? Freddie G, the cockapoo. Amy, my cat loves peanut butter. When he sees us eating a peanut butter and jelly sandwich, is it safe for him to have some and how much? Nope, I prefer not. These high calorie, dense food items are make these pets not only prone to weight gain and obesity, but also it is risk for like diseases like pancreatitis. So I prefer not. They just don't need that, you know. So unfortunately, cat just has to watch you guys eat it. The Grongster Monster. What a cool name. What's up? Welcome. So yeah, Amy, I would avoid eating, having your pet eat human foods like that. It's you're just risking yourself for issue. You're just risking issues with your pet if that's the case. So, okay, so we were talking about gastrointestinal disease. Try the basic.com gastro booster for dogs. There are other supplements on there, but I figured this entire conversation has basically been based on gastrointestinal health for dogs and cats. So I hope that's very useful for everybody. Thorgon 9, what was the most difficult time you've had as a veterinary surgeon? I will tell you what's the most difficult time. It is trying to find a facility that has the appropriate work culture that is both suitable for efficiency and suitable for the health of the employees. That's the most difficult time. There are corrupt practice owners out there, and you know who you are. There are corrupt leaders out there, and veterinary or not, but usually veterinarians run the show, so they're usually the problem if there's going to be a problem. And so the toughest thing is a toxic work culture. And if you know who you are. You know who you are. So that's probably the toughest thing, and that's tough for any workplace is the culture. I have my thoughts on what causes a toxic culture, how to fix a toxic culture. So these are all things that I'm really passionate about. I worked at places that just didn't agree with my point of view, and I know that they are hurting with the culture because they don't know how to do it. So that's the way it is. But yeah, I think culture is probably the toughest thing to deal with because that defines everything. That defines how happy the vet staff is. That translates to how effective they're going to work. How the pets are. Well, it doesn't really affect pet treatment per se, but if you have a negative kind of culture in the profession, in a place of employment,